Hello, psychology students, and welcome to Chapter 6's chapter on the brain. I can't wait to talk to you about the different parts of the brain. So to begin with, we're going to be using a couple of things with our notes. Remember that you can pause, stop, start, go forward to whatever you need to make up for the notes that you missed. You are going to need your Chapter 6 packet on the brain, and it will have your diagram on the front. So we will be using that today, and then also we'll be using your notes that are here on Google Classroom. Okay? So to begin with, I want you to know that that really cool picture you see on the title screen is actually a real picture of a brain, believe it or not. It is an imaging technique that we're going to talk about later on. So let's begin. All right, first of all, I would like you to get out your 6-2 packet, and we are going to label some things on the brain. Obviously, on your test, you're going to need to know these parts of the brain. So I'm going to give you some little clues to help you remember them. And I know they sound silly, but I've had students email me and say, I promise you it works. So go ahead and get that out. And we're going to start out by talking about the lobes of the brain. The brain is broken into 4 lobes. All the wrinkly stuff that you see, this way, in the brain, okay? Those are the lobes that we're talking about. So we're going to start with that in our first section. Okay, so I'm going to use this one because it's got a really nice, colorful view of those different lobes. All right, so if you look at the front of your brain right here, I want you to touch this part, okay? This is your frontal lobe. Easy to remember because it's in the front of your head, right? Now, there are 2 really basic parts in the frontal lobe, okay? And we're also going to have you write some notes next to these. So write your frontal lobe, and then in the front of that frontal lobe, we have the prefrontal lobe. So this part right here by your forehead, this part is what helps you recall events. So for example, think about what you did last weekend. You would be using your prefrontal lobe. And that's why a lot of times when people get in a car accident and they hit their head, they forget things from what they did in the past because they've been damaging that part and it's swollen. So, okay. So the prefrontal does recall memory. The frontal lobe that's right here on the top of your head right there, that would be where you're planning for the future. So if you thought about what you're going to do this coming weekend, you're using your frontal lobe, okay? So recall, frontal lobe would be then planning for the future, okay? Now you notice that there's almost like a headband going across the top. That's your A1 right here. It is a part of the frontal lobe, and that is called your motor strip. Now, what do you suppose a motor strip does? Think of motor. It's your movement strip. It's what helps you stomp your foot, wave your hand, okay? Those are your motor activities. So that all comes basically from that part of your brain, okay? Make sure you get those down in your notes. Now the B section, this is right on top of your head, right here on the top of your head. That would be your parietal lobe. Now it's easy to remember because it gets its name from the bone that's right at the top of your head right here. If you feel that hard piece, that's called the parietal bone. So that's where it gets its name. Okay. The parietal lobe is all about senses. This is what gives you pain, whether you're cold or you're hot, that kind of stuff. Okay. So to go into more detail, you'll notice that there's another headband that's right here, and that is that B1 section. That's called your sensory strip. So again, imagine what you're using there. We're using all of our senses. So smell right now where you're at. What do you smell? Do you smell dirty socks in your bedroom? Do you smell your mom cooking dinner? Do you smell cologne or perfume? You would be using your sensory strip, and in particular, your parietal lobe. Okay? So that's what's going on there. Now, a little trick, the way I remembered this for my test, is remember that you have 2 headbands, right? Motor strip, sensory strip, and they go in alphabetical order from front to back. So you've got the motor strip, and then you've got the sensory strip after it as it moves backward. Just a little trick that I learned. Okay, letter C back here is your occipital lobe. If I can get it to show up. There it is. Now, does anybody know when you hear that first word, that occipital, what that OCC kind of stuff sounds like? Has to do with your eyes. Ocular has to do with your eyes. Okay, so this is what helps you see. It's kind of weird. Think of it this way. When you go to a drive-in movie or a movie theater, you have your movie film projector in the back of the theater, and then we see it out in front. So that's basically what's happening in your head. You're letting it in with your eyes. It's going to the back occipital part of your brain, and then it shoots it out so that we see it almost like a film out in front of us at a movie theater. Okay. The other way to remember this is, you ever heard your parents say, "I have eyes in the back of my head"? Great example to remember the occipital lobe. I have eyes in the back of my head. Okay. So we got the frontal lobe. That's our thinking, our planning area, right? Or our recall. Our motor strip, which is our movement. Our sensory strip, which is our senses, our smell, our touch, all of that. And the parietal lobe, where our parietal bone is. And our occipital is our sight. Again, the more you can touch as you learn these, the more it'll stick in your brain. Okay? And letter D. This is your temporal lobe. Really easy to remember because what is this right here? We call this our temple, right? So temporal lobe, our temple, same area. Okay, and this area right here, I bet you can guess what it does. What's right next to it? Your ear, right? So this is what helps you hear. This is your auditory part of your brain. So just remember that kind of goes along with your hearing section. There's some other things, but that's basically the biggest one to remember it by. Okay. All right. Then we have two little areas that I'm not going to talk about right now, but I'm going to have you write them down on your map. All right. On your brain map. Letter E over here is called Broca's area. And you can kind of make it your own, make a little circle there or something so you can see it. That's Broca's area. And then letter F is Wernicke's area. Okay, so now let's head back to our notes online here, and we'll be referring back to that diagram as we go. Okay? All right, so to begin with, the nervous system has two major parts. We have the central versus the peripheral system. Okay? The central nervous system, or CNS, central nervous system, includes your brain and your spinal cord. Easy to remember, it's in the center of your body, central nervous system. Along with all those nerves, central nervous system is in orange here. And then the last part is your peripheral. This is basically the outside of your body. All these nerves on the outside of your body are your periphery. I don't know if you've ever heard someone say, "I want you on the periphery of our area." That would be the outlying area of wherever you're camping. If you're a soldier, you're guarding the periphery of your region. Okay, so these are the nerves that connect to all the muscles and organs. And again, we can use abbreviations there, the PNS, the CNS. Okay, so those are your two basic nerve systems. Within the nervous system, there are three kinds of neurons that connect the CNS to the body. We have the sensory, the afferent or inward going neurons. We have the motor neurons, which are efferent, going outward. They're going out to your hands and your legs and your feet. And then you have your interneurons that are in between, right? Makes sense, inter. Our motor, basically our central nervous system is going out to our muscles and our organs. And our sensory, of course, are sensory receptors that go in to the CNS. So I touch that hot stove and it's hot and my fingers feel that heat and it immediately rushes to my central nervous system so that my brain will say, "Hey, idiot, let go of that hot plate." And you react. Then you have your interneurons, and those are basically the connections within the central nervous system that you see there. Now, within the periphery, those outer neurons, you have some different kinds. We have somatic nervous system, and we have the autonomic nervous system. And within the autonomic nervous system, we have parasympathetic and sympathetic. So don't freak out. We're going to talk about each of these on their own here. So let's go on to the next slide. Okay, so first we have the somatic system. Okay, so let me define it first. These are nerves to and from the spinal cord. They control muscle movement. That's the key word there, muscle. They have somatosensory inputs, and it does reflect both voluntary and reflex movements. So these are the nerves that help me pick this up, and I'm telling my body to do that. And there's also reflexive movements, like when the doctor hits your knee and you involuntarily just react, or someone throws something at you and you react. Okay, that would include both of those movements. So the way to remember somatic system is, I always think somatic, so many muscles. So many muscles. I know it's silly, but for me, it works. Okay, so you'll see a diagram of what we talked about right over here. For example, you've got your skin receptors touching whatever it is, and then your muscle, your motor neurons, your sensory neurons going all the way up to the brain and the CNS, central nervous system. Okay. Then we have the autonomic system. The best way to remember autonomic is think automatic. These are things that we don't have to think about. They just automatically happen for the most part. There are two divisions. We have the sympathetic and parasympathetic, but we'll get to that on the next slide. Okay. So basically, autonomic controls all your involuntary functions, things that we don't have to think about, like our heartbeat. We don't tell our heartbeat to move, it just does it. Our blood pressure, our breathing, our respiration, our perspiration when we sweat, our digestion. We don't have to tell our stomach to digest our food, it just happens. So the autonomic system is what does those things. Okay. Now, of course, those things can be influenced by thought and emotion. For example, your heartbeat naturally just beats. However, when you see a really cute girl walking down the hallway, guys, your heartbeat about beats out of your chest, right? Because you are thinking about that girl and it's affecting those functions. So that's why I put this little guy over here with his heart beating. Okay, so that's autonomic. Now, within autonomic, we have sympathetic and parasympathetic. Let's take a look at those. Okay. So if you look at parasympathetic is what basically calms down your body. And your body reacts to calm things down, and your body reacts because you're calm. So when you meditate, for example, your saliva starts to flow, your heartbeat slows down, your bronchi in your lungs constrict, you secrete bile, believe it or not, your digestion kind of calms down and starts to move, your bladder constricts. So this is when you calm things down. Your sympathetic is a little different. This is like fight or flight kind of a reaction. So I always think of like the moment you see a snake underneath your feet, and boy, oh boy, your body goes into like survival mode. So for example, you don't even realize it, but your pupils dilate because you're instinctively wanting to see what it is that's giving you danger. It stops your flow of saliva, which kind of explains why when you get nervous, speaking in front of a group, you don't have any saliva on your tongue. That's why. It accelerates the heartbeat, of course. Your heart starts beating faster. Your bronchi dilate and your lungs start getting bigger and breathing heavier. You have secretion, your all kinds of stuff. Your adrenaline and noradrenaline starts to secrete all those chemicals in your brain that make you ready to react. And it inhibits bladder contraction, actually. So the way that I remember this sounds dumb, but with the sympathetic, I think, oh, I'm sympathetic to you for stepping on that snake. I don't know why, but for some reason that helps me remember it. Okay, so there you go. Parasympathetic and sympathetic. All right, so let's talk a little bit about the brain now. We've talked about the nerves. Let's talk about the brain. Remember that the brain has two hemispheres, right? The right and the left hemisphere. And they are connected by a corpus callosum. Okay, so let me see if I can open this up for you. You see this, like, I don't know if you can see it, this C-looking thing? That's the corpus callosum. And that's what connects the two parts of the brain together, and it sends messages back and forth between the two. Because as you can see, some functions are lateralized. For example, language. When you learn language, that's the left hemisphere of your brain. Spatial tasks like organizing things or music comes from the right side of your brain. But lateralization is never 100%. For example, even when you do your language, you're going to use both sides of your brain at some point. There's always a little bit of crossover. And that's why you need the corpus callosum to allow that crossover to happen. Okay, I told you I would tell you about those two little weird splotches, like Broca's area and Wernicke's on our diagram. Well, that's what this is about, okay? This is basically how we learn new words or vocabulary in the brain. And it's amazing how many different parts of the brain we use. So, for example, to read the words, we see the word on the paper, we're using the occipital lobe, right? Because we have to see it. If we hear our teacher say it out loud, we're using the Wernicke area, the one that's by our ear, right? If we want to think about the word and what it actually means, so let's say we want to take that new vocab word and we want to define it, we're planning, right? So in that case, we're using that frontal lobe. So we're using Broca's area up here. And to actually say the words out loud to your partner, you're using the motor strip that we have right here, which is your motor cortex. So lots of parts of your brain's working with just one simple vocab word. Kind of cool, huh? Okay, this kind of talked a little bit about how our brain crosses over a little, okay? So for example, when you see, you have probably heard this, but you basically cross over in your hemispheres. Okay, it's called contralateral, meaning it crosses over. Sensory data crosses over in pathways leading to the cortex. So for example, when you look at something, in your left visual field, it goes to your right hemisphere of your brain and the right visual cortex in the back, in your occipital lobe. Same thing in the right field, it goes to your left visual cortex, and it's crossing over in that corpus callosum that we talked about. Other senses are similar in that way. Whether it be hearing, we tend to cross over, stuff like that. Okay, if you look at some of these here, let's take a look. Movements are controlled by motor area. That's our motor cortex or motor strip. The right hemisphere controls the left side of our body, and the left hemisphere controls our right. And the motor nerves cross sides within our spinal cord. So that's why maybe if you've had like a grandparent that had a stroke on the left side of their brain, they might have paralyzation on the right side of their body because it crosses over. So this guy is Homunculus Man, and I think he's kind of interesting. This depicts what humans would look like if our parts grew in proportion to how much we sensed them. So first of all, let's look at our senses. Notice what things would be bigger as to how much we use them. Our hands, because we touch things all the time, right? Our mouth, because we're always talking and we're always tasting things with our tongue. Good. Our nose is pretty big too in comparison to the rest of our body, right? Because we're smelling and we're hearing and we're seeing. Okay. Now take a look at your motor stuff. The things that we use the most? Look at how skinny his legs are in comparison to our hands. How much we use our hands all day long. How much we talk or eat or chew. Our mouth is really big, our nose, our eyes, and the rest of the body is tiny. Isn't that funny? This shows you homunculus man and basically what parts are being used within what part of the brain. So remember our sensory strip? If you look, it kind of shows you in perspective how much of that sensory strip goes to our face, like our lower lip, our lips, our upper lip, our face, our nose, our eyes. Your hands would be all of this area here on the sensory strip. And then the rest of your body basically is here. Okay? Over here, you've got your tongue, your pharynx, your abdominal, your teeth, your tongue. Over here, you've got your motor strip. Let's take a look at that one over here. Notice how much of your motor strip, your movements, go towards your face and your hands as compared to like your foot or your ankle or your knee even. Isn't that crazy? Take a look at the amount that goes towards swallowing, your tongue, and your jaw. Okay, now we have what we call some fissures. And these are basically splits in the brain. So let me show you those. If I can get it to come up. There we go. Okay, you'll see there's kind of a fissure right here just above the temporal lobe. That little break is called the Sylvian or lateral fissure. And there's one up here that I'm probably covering up. Oh, this is the transverse fissure back here that separates the cerebellum from the rest of your lobes there. And of course, this one that goes down the middle of your brain on the top, if I can get this back out. There you go. This would be your longitudinal fissure that goes down the middle of the two hemispheres. And then, of course, as we just wrote on our diagram, each hemisphere is divided into 4 lobes. We have the frontal, parietal, occipital, and temporal. So we're going to go over those and just make sure you've got your notes down on those. Okay, so remember that our frontal lobe in the front of your head is close to the central sulcus. It also has the motor strip region. It is in charge of planning, movement, decision-making, and judgments. So a very important part of our brain. And notice how much of it is the frontal lobe. It's a big chunk, isn't it? The blue area is our parietal lobe. Remember that we get it from the parietal bone that you see right here in that diagram. This is where we have our sensation. Remember, we have our sensory strip in there. Sensation of touch, pain, and temperature. You know, you ever heard people say you need to put your hat on, because it's cold outside? Well, it's not necessarily because it's been proven to make you sick if you don't, but it's because this is the part of your brain that reacts to heat and cold. So if it's cold outside, it escapes out the top of your head, okay? That's what senses that you're cold or you're hot. So that's kind of where that comes from, I believe. Then you have your occipital lobe. This is your final destination for visual or vision. Remember the eyes in the back of your head or the movie theater, okay? And the temporal lobe in pink here, that's responsible for hearing. Remember, it's right by your temple. And another way that Miss Ebright has people remember it is think like the tempo of the music, okay? Has to do with hearing and your ears. So whatever works for you, we'll use it. Okay, this is actually part 2 of our notes, but I'm going to do it all in one. So in this section, we're really going to go into detail on the parts of the brain, not just the hemispheres and the lobes. So what we're going to do now is we're going to actually label all the little numbers that are on your diagram. So if you can get your diagram out, we're going to label those things and take some notes on it. And then we'll, you'll be looking these things up. But I'll try to help you out with some things and give you some little clues to remember things by. Okay? All right. Okay, I'm trying to get myself out of the way here so that I can do this. Okay, so let's start with number 1. This is all that wrinkly stuff up there. Number 1 is called your cerebral cortex. Cerebral cortex. And if you remember, this is the part that is broken into 4 lobes. That's your cortex, all the wrinkly stuff. Okay. Number 2 is your corpus callosum. This is that white thing right here. Now, the way that I remember that is it looks like a really big C. Okay. So I just remember we've got 2 C's here, corpus callosum, and it looks like a C. And you got number 1 is both C's as well. So they're the 2 on top. Okay. The corpus callosum, again, is what sends messages to both hemispheres. So if you want to write some notes down below that, that might be wise. Okay. This sends messages to both hemispheres of the brain. All right. Now, I know I'm going to number 4, but there's a reason because it helps you remember something. Okay. Number 4 is called the hippocampus, and that's this top line right here. And if I were you, I would highlight or kind of underline hippo. There's little clues for you to remember things. The hippocampus is kind of in charge of our memories, to be honest with you. This is where we store our memories. Then number 3 is right out here in the front portion of that area, and that's called our amygdala. Our amygdala is what controls our emotions and our aggression. So think about emotions when you think of amygdala, and highlight Amy in the word amygdala. Number 5 is this bottom line of this oyster-looking area, and that's called your thalamus. Thalamus. The thalamus is kind of your relay station, and this is what sends movement and sensory signals to different parts of the brain and the body. Sends movement and sensory signals to different parts of the brain and the body. And again, you want to highlight the TH in thalamus. Number 6 is your hypothalamus. Easy because they're right next to each other. So you've got thalamus, hypothalamus. This is a really important part of the brain because this regulates your body temperature, your sex drive, your thirst, your hormones, stuff like that. So it is definitely important. And again, will you please highlight HYP on hypothalamus? Hype. Now we're going to skip down to number 7 here. Number 7 is your pons. Highlight the letter P. Your pons stimulates your breathing and controls your sleep cycle. So again, very important for sleep and breathing. Number 8 is your medulla. Highlight the M. The medulla controls your heart rate, your breathing, and your blood pressure. So you could see why a neck injury is a very serious thing because it can very quickly become a very serious issue with your heart rate and your breathing. So that's why they definitely don't want to move you and they put you in that cast, basically. Number 9, of course, is your spinal cord. You've probably heard of that before. Highlight your S. And this, of course, is what sends signals out to the rest of the body, between the body and the brain. Sends signals to the body and the brain. Now, originally, when we taught this, we taught these three areas down here really easily because it says PMS. And everybody knows what PMS is, right? Okay. But I thought, you know what? The things my students tend to get wrong are these little things down in here. So there's got to be a way to remember it. So I came up with this really silly sentence, but it works. Okay. So if you could put this sentence down, I promise you, I think it will help. It says, the hippo and Amy thought about hypnosis for her PMS. The hippo and Amy thought about hypnosis for her PMS. And if you look at it, it goes in order. The hippo from hippocampus and Amy, that's next. If you're going straight down, 1, 2, 3, okay. Thought, that's your thalamus right here, about hypnosis. Here's number 6, hypnosis for her PMS. It's a mnemonic device, and sometimes those sentences are silly, like the one you did with your planets, but sometimes it works. So, okay, now let's look at the ones that we're missing over here. Number 10, very important. That is your cerebellum. And the way I remember that is I would highlight the word bell because it looks kind of like a bell. It's separated from the rest of the brain and kind of hangs on there like, you'll see. Oh, I can't do this. You see how it kind of hangs off on its own? Looks kind of like a bell. Okay. The cerebellum controls motor skills, and it basically has 50% of all the neurons in your body in that little area. Controls movement, so it's very, very important. Number 11 is kind of hard to see. It's right in this little crevice between pons and the cerebellum. That is called your RAS. You won't need to know what it stands for, but just so you know, it stands for Reticular Activating System. And the RAS is the gatekeeper, we call it, the gatekeeper of info. It controls your coordination and your balance. It also helps you maintain consciousness and helps us awake from sleep. So you can see why that's really, really important, especially when you're talking about neck injuries. Maintains consciousness and also helps us awake from sleep. That's the RAS. And our last one is number 12. It's this tiny little, looks like 2 cherries on the end of a stem. That is your pituitary gland. And if you've heard any things about glands, obviously this is what helps you grow, what helps you develop your sex organs, helps your voice drop, helps you become an adult, all those lovely things. So very important. Has to do a lot with your hormones and your sex drive as well. Okie doke. All right, we got a few more clues for you coming up, but those are just a few. All right, let's take a look at our notes now. Okay, one of our clues, if you look at amygdala, it's part of the limbic system that controls emotions, as I said, aggression and emotional memories. So again, remember that you know an emotional Amy. Amy is emotional. And if you remember that, you'll remember amygdala. If you look at the hippocampus right here, another way to remember this, if you can't remember the sentence, is that it camps around the other parts of the system. It kind of curves around the outside. You'll notice that. So it's kind of like a camper, hippocampus, camper. And that is involved in explicit memories. And another thing, the RAS, so the reticular formation, This basically alerts the cerebral cortex to incoming sensory signals. It maintains consciousness, wakes us from sleep. We kind of mentioned that already, but just a reminder that that's what that area does. Okay, so now we're going to do one of the parts of this test is we look at different tests that we can use to image the brain and look for different things in psychology. And there are quite a few of them. So let's take a look at them and see what each of them do. And we'll show you some examples of it. It's pretty cool, actually. These include the EEG, the CAT scan, the PET scan, the MRI, and the MEG. There's one more. There's a MEG as well. Okay, so first of all, let's take a look at the CAT scan. This is kind of what it looks like. How many of you have had a CAT scan out there? Yeah, it's pretty common, isn't it? Okay, so a CAT scan or CT, same thing basically, uses an X-ray system, and it cross-sections slices of your body, and it looks at the soft tissue in your body. It's not looking for bone, it's looking for soft tissue. This one right here, kind of interesting. This is showing a tumor that is actually pressing on the brain. So now that you know what parts of the brain do what symptoms do you think this person had that made them go into the doctor, knowing the parts of the brain that you do? So it's over on this side, right? It's right over here. So they were probably having trouble with planning or thinking, right? Because that's up here in the frontal cortex. May have affected some of their motor skills and their sensory skills right along here. And notice it's also grown in this area. So it might have even affected their hearing, as well as their balance if their hearing is affected as well. So you can kind of imagine that. Important for us to see things like that. The next one is the MRI. And again, you'll go through this machine and it takes sliced pictures. But in this case, it uses a magnetic field and radio waves to create really detailed images of the organs and tissue in your body. Stands for magnetic resonance imaging, by the way. Not that you need to know that for your test. But here, kind of sad, you'll see this is an MRI of a normal 43-year-old and a 43-year-old who is an alcoholic. And you'll see a huge difference in their brain. Here's what's happening. It causes chronic brain damage, and it erodes parts of the brain. It also depletes dopamine. We talked about that the other day with our neurotransmitters. And so we don't get enough dopamine production, and it causes it to function at reduced capacity in an abnormal manner, as you can see there. So it's basically you're killing off parts of your brain. And this study was actually talking about how they were very concerned that alcoholism really starts in your 20s, when you're in that college age, and people are getting addicted and they're just destroying parts of the brain because the brain is not fully functional until you're 25. So there's a lot of damage being done, and that's kind of what the article was about. Here is an MRI, an anterior view of a real brain. Take a look. Isn't that interesting? Kind of gross. And of course, we got to see the back side or the side. Here's the cerebellum that we talked about. Spinal cord. Okay, this is an EEG. And this is used to detect electrical activity in the brain. And we've talked about this. The neurons fire and it creates an electrical activity, right? So that's what they're measuring, actually. This is really good for finding seizures, tumors, people that have had a stroke or are suffering from dementia. So it's used in a lot of different ways. So here's a reading of an EEG. This actually shows a person having a seizure. So this is their normal reading. Now remember, each one of these would be one of the little electrodes on their head, okay? And then all of a sudden you see, oh, heck breaks loose here. And what's happening is there's excessive messages just flooding the brain. And that's what happens when you have a seizure. And they mentioned that parts of the brain affected may determine the symptoms. So, for example, if it's this part, it might affect your hearing. If it's this part, it might affect motor skills. So it might affect your leg, and you might start having your leg shaking or tense up. If it's a part that affects speech, it can affect your speech. So depends on what part of the brain is being affected. But here you'll see they're affected in many different places. This is a PET scan, and again, you tend to go through. In this case, however, they're looking at a different thing. You're given a special dye with radioactive tracers in it. It can be injected or swallowed. For me, I've had these a couple of times, and it was always through an IV. So I had radioactive stuff going in there, and it usually is a little bit, I think it was cold if I remember the last time. So they kind of warn you about that. And basically what they're looking at is they're looking for blood flow and what's stopping blood flow, possibly. They're also looking at how your organs are functioning and stuff like that. This is a PET scan here. This is actually a brand new technique, and they're using it for Alzheimer's patients. It used to be that you really couldn't be diagnosed with Alzheimer's until after they died, and then they did an autopsy, and they would go into the brain and cut into the brain, and they would find this. But now they're finding that a PET scan will do that job. They can identify what they call plaques. I had to look it up, which is basically an abnormal cluster of protein that is building up between the nerve cells. So when the nerves fire, there's something in the middle. So the nerves are not getting to that next place, which is why they're forgetting things, because the neurons are not connecting and not going to that synapse like they should. And that's what's happening here. Here you see someone without Alzheimer's, and you see all these areas where they see plaques. This is someone that does have Alzheimer's. This is a MEG scan. It is used to measure the magnetic fields produced by electrical activity in the brain. So it's really looking at something a little bit different, but it's based on the electrical activity. It is non-invasive. It is painless, which is great. It is the most expensive of the ones we've looked at so far because it is more rare than the others. So just be aware of that. And if you look, this one was really interesting. They were using this to compare soldiers with PTSD. And one of the things about MEG is it can get in deeper in the brain than any of the other images that we looked at. So what they did is they used a control. These are soldiers without PTSD, and they're in a resting state. They're just sleeping, for example, or just sitting there calmly. And you'll see what parts of the brain are lighting up. And then here you see the soldiers with PTSD, and you'll see that they're much more active, and more parts of the brain are firing even while they're in resting state, and they just can't calm those memories down. So kind of interesting. Okay, at this point, I don't think we need to do notes on this. This is our candy brain activity. You are going to be creating a brain out of an orange and a lot of candy. So at this point, we'll say goodnight, and we'll see you next time with our candy brain activity. Take care.